Welcome back here to Midday Kentucky. Dr. Case and staff at Gastroenterology and Hepatology of the Bluegrass treat a broad range of conditions that affect the digestive system, and with extensive education and training, this doctor brings up-to-date care here to Central Kentucky. We wanted to bring in Dr. Justin Case here to tell us about how a colonoscopy can save your life. Thank you for coming in today, Dr. Case.
Thanks for having me.
So first, let's start with, what is colorectal cancer?
Colorectal cancer is a cancer that arises in the inside of the large intestine, so that's just a name we give to all large intestinal cancers that come from that lining.
And you also brought up a polyp. What is that?
So thankfully, colon cancer comes from polyps, and those are small growths that initially are benign, and over time they can grow and become cancerous. That gives us the opportunity of going in and intervening before they can grow into a cancer. They can be snipped off easily during a colonoscopy, so they never will become a cancer.
And this is such an important topic to talk about now, being Colorectal Cancer Awareness Month. Let's talk about who is at risk. How common is it?
Colorectal cancer, unfortunately, is pretty common in the United States. It's one of our more common cancers. That's why screening is so important. The average person like you or I would have a chance of getting colon cancer of about 5%, or 1 in 20. So overall, in the United States, we have about 140,000 cancer cases a year, and about 50,000 people die a year of colon cancer.
And is that men and women?
Right. Men are at slightly increased risk,
Okay.
but there is some risk for everyone. So the average person is about 5%.
So people sitting at home wondering, what can they do? Is there anything that we can do to reduce our risk of colorectal cancer?
Well, we can't totally eliminate the risk. However, there are a few lifestyle changes that you can make. Maintaining a healthy diet, a healthy weight, that's important. Stopping smoking, consuming alcohol in moderate amounts is all helpful. Unfortunately, that does not eliminate your risk of colon cancer. So the most important thing is that you be screened for colon cancer.
So let's talk about maybe screening options or detection. I've heard things thrown out, and I know we see things posted online. Can you give us any advice on what's best?
Well, we think that as gastroenterologists that colonoscopy is the best way.
Okay.
That's a somewhat invasive test where you come into an office or an outpatient center where you have a scope inserted through the bottom, and you can physically examine the entire colon for precancerous growths like polyps or cancer itself, so it can be identified early. There are other options, though, that are non-invasive, such as x-rays. There are CAT scans, as well as some stool tests that you can do at home. If you're not comfortable with going into an office and having an examination, or you're at too much of a health risk to undergo a procedure, then you can have a home kit to do.
And when should we start thinking about colonoscopy? Is there an age range?
Right. So at around age 50, we recommend that everyone at least talk to their physician about getting a colonoscopy. The risk of colon cancer rises sharply around the age of 50,
Okay.
so we start screening everyone at 50. And your primary care doctor or gastroenterologist can advise you on what your risk is based on your family history, what medical conditions you have at baseline, and what might be best for you.
So maybe if people at home are approaching that age or have a loved one around 50, they want to get a colonoscopy, do you have to have an order to get one? How do we get that ball rolling?
Typically, we'll get an order from a primary care provider, but that's not necessary.
Okay.
You can call the office, or any office for that matter. There are plenty of gastroenterologists in the area, including myself, that can usually get people in really promptly to get these things done when it's convenient for them. But it also is very easy to ask your primary care doctor to send over an order as well.
And does insurance cover a colonoscopy?
A screening colonoscopy is usually really well covered by insurance companies.
Okay.
It's a preventative measure, so they consider that a good investment in keeping you healthy. So they typically will cover that very well.
So for people who now hopefully are realizing maybe they need the screening test, the colonoscopy, how can they get in touch with you? Should they maybe see a primary care to advise them? Not
necessarily. Like I said, everyone around the age of 50 is recommended to probably have one. If they have some special concerns, they can obviously contact me or their primary care doctor about doing that. But overall, if you just give us a call, we can make an appointment and get it done.
Well, we appreciate you taking the time to come in and talk to us. Really important information for our viewers. We have all the contact information there up on the screen. We'll also post this over on our website and our Facebook page. Really not something to put off once you hit that age, right?
Right, exactly.
Dr. Case, thanks so much.
Thank you.
Well, we'll send things to break, but we have your What's Poppin' on the other side.